All right, good morning, or I guess afternoon. Welcome. We are letting folks in and we'll get started shortly. Glad to have everyone with us today, and looking forward to a great webinar. Giving folks just a minute longer if you're joining us. Thanks for coming and getting all of this started, getting everyone logged in real quick. All right, we are letting folks into the webinar. We will get started shortly. Thank you for joining us today. And all right, we're going to get started. Hi, I'm Anna Osland. I'm the Director of Research at the Blanco Public Policy Center, and we're excited to welcome you to our 12th Lunch and Learn for Whole Health Louisiana. Whole Health Louisiana is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder of the Whole Health Louisiana initiative, and the Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with Whole Health Louisiana, it is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care. Whole Health Louisiana has 4 priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, Whole Health Louisiana's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. All right, I'll turn it over to Quinn now, who will be the moderator for today's session and introduce our speaker.
All right. Hi, everyone. Sorry about the delay. Something is wrong with my Zoom now. Even though it was working earlier. Okay, so hi, let's get started. As Anna said, I'm Quinn Nguyen. I'm a research associate here at the Blanco Center and a coordinator for the Whole Health Louisiana project. I will be moderating this webinar and all of our future webinars along with my colleagues here at the Blanco Center. As part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the Whole Health Louisiana plan and features presentations from industry professionals and subject matter experts. Due to the popularity of the series, we'll be continuing it through the upcoming year. And for this year's series up until December, we'll be focusing on trauma-informed care in specific workplaces. And all of our planned webinars are on the Eventbrite page that you all use to register for today's events if you're interested in looking forward to the other topics that we will be presenting. So in addition, if you are attending for CEU credits, please remember to fill out the CE credit request form and complete the post survey to receive your credits. I'm now going to go ahead and introduce our speaker for today. Our speaker for today is Stalanda Butcher from the Center for Children and Families. She is the Chief Advocacy Officer, and within her role, she is responsible for the implementation, oversight, and advancement of all advocacy programs and divisions for the center. These programs and divisions currently include court-appointed special advocates known as CASA of Northeast Louisiana, the Children's Advocacy Center of Northeast Louisiana, Brokers of Hope, and the Family Support and Youth Transition Program. She holds a master's degree in secondary education and a master's in public health. Before joining the center, she was vice president for Head Start Services with the Louisiana Endowment for the Humanities. She was also a manager with the St. Francis Medical Center school-based health program and has served in multiple leadership capacities with the Children's Coalition for Northeast Louisiana. Her entire professional career has been paved with programming that supports vulnerable children and families. She believes she has a personal responsibility to do all she can to help ensure that children and families thrive and that their voices are heard. And with that, I'm going to go ahead and hand it over to her to start her presentation. Thank you.
Thank you so much, Quinn, and good afternoon, everybody. I hope you all have something good to eat and you are ready to rock and roll, because I know I have greatly anticipated this time, and I'm so elated and thankful and honored that I have the privilege to be with you on today. So today I have the opportunity again to be with you in this Whole Health Louisiana virtual space to look at the ABCs and 1, 2, 3s of integrating trauma-informed approaches into behavioral health settings. Now, I am coming to you live from Monroe, Louisiana. Yes, you heard it, Monroe, Funroe, Louisiana. And in the words of Roy Heatherly, the president and CEO of the Monroe Chamber of Commerce, it's a beautiful day in Monroe. And I hope you can say the same for wherever you are at this moment in time. So team, as we engage with each other for the next 45 minutes or so, I have 4 overarching lunch and learn objectives that I would like for us to keep in focus. So since it is lunchtime, I'm going to give you an appetizer. So as the appetizer, when looking at the background knowledge, I will define trauma and its impact. As a guide, I will explain the principles of trauma-informed approaches. And then we're going to jump into our presentation entree as I explain some foundational pieces of being trauma-informed within behavioral health settings. And then as a dessert, because hey, for all my sweet tooths, we have to have dessert, to have something sweet, we will look at the call to action. Yes, because when we leave here, there's some things we're going to have to do. And I'm going to ask that we commit to at least one change to support a trauma-informed culture. Now, as we go through our objectives, I will do so with a few guiding principles in mind as your presenter. First, you will notice that I will refer to you, the audience, as my team or teammate. Why? Because I truly believe that we are in this work together. As my teammate, I will show you utmost respect and will do my best to engage throughout the presentation. So from what I understand, I'm gonna have a helper here by the name of Brooklyn, and we're gonna have some activities to do in chat. So I'll be calling on her in a little bit. So get your fingers ready and moving, because again, I want to engage with you. Also, team, I will strive to ensure that my communication is clear and purposeful, and that I am a good steward of our time together. I will also present with openness and transparency, and I'm going to do my best to be as adaptable as I can while in this virtual space. All right, so keeping our objectives and guiding principles in mind, I also have a little more housekeeping I want to do. And I would like for you to know the context for which I will engage with you today. Now, team, I am not a behavioral health therapist. My background is in public health, education, and nonprofit leadership. And I'll be bringing a lens to our conversation today that has these various angles. Again, public health, education, and nonprofit leadership. You're also going to notice that I'm going to reference where I work a whole lot because I'm proud of it. As Quinn noted, I am with the Center for Children and Families. And at the center, our mission is to promote safe, healthy environments that serve children and families. And each day, we carry out this mission through advocacy, counseling, education, and prevention. As part of this work, we were selected to be a pilot program with the Louisiana Department of Health for the Whole Health Louisiana initiative. And through this work, we will provide training and technical assistance to support organizations in Northeast Louisiana as they participate in capacity building efforts to integrate trauma-informed approaches. I also want you to know that the elements I present today will be framed within behavioral health settings, but please know, team, that all of the approaches can be applied across different workplace settings. We all can learn from each other. So now that I've given you a little bit of context, I want to hear from you. Brooklyn, I hope you're ready to come off mute and let me know what you see in the chat. So teammates, right now, in this virtual space, you know a little bit about me. I want to know about you. So if you can, get those fingers moving, type your name. Let us know your profession. Are you a therapist? Are you in education? Are you a nurse? Are you a stay-at-home mom? All those beautiful things. Put that in the chat. And Brooklyn, let me know what you see. I want to know who's on my team today.
Okay. So we have someone who's a clinician. We have Dave and Patrick, who is a community resource specialist at the
Okay.
Disability Resource Center. We have an HR director. We have a licensed professional counselor. We have a professor, a retired LPC, someone who works for DCFS, someone who works for a social worker. A lot of folks in the chat. It's just kind of going too fast. We have Katrina, who is the LA Care Network Program Coordinator.
Okay, give me a couple more, Brooklyn.
Okay. We have Dr. Matt, who is who works in higher education and who's now moving to nonprofit work. We have
Hello,
Anna
Matt.
Castile.
Yes.
Yeah, we have Anna Castile, substitute teacher. We have Barksdale, who is an attorney and who works with the mental health unit of the Orleans Public Defender Office.
Okay, great. It sounds like we have a mixture. I like to hear that. Brooklyn, one more question I want to give my team
Yes.
today. So if you can stay with me. Team,
Hmm.
let's hear from you. When I say trauma informed, that's a big hyphenated word. What is the first word that comes to mind? I know it may be hard, but I just want one word. So type that in the chat in Brooklyn. Let me know what you see. Again, when you hear me say trauma informed, because you're going to hear me say it a lot, what's the first word that comes to mind? In Brooklyn, what do we have in?
Yes. We have awareness. We have
Okay.
TBRI. We have safety, aware, research-based, hope. Oh, that's a good one.
Oh, yeah.
Empathy, safety, EMDR,
Okay.
education, understanding.
Give me a couple more.
Okay, they're coming in.
Okay. Yeah, Brooklyn didn't know I was going to work her today.
No, it's okay. We have buzzword.
Oh, buzzword. Okay. And give me one more.
Okay, let's see who's going to be our last person.
Okay.
Emotional.
Emotional. Okay. I like that we're ending there. Thank you, Brooklyn. But Brooklyn, you be on standby because I'm going to call you
Yes,
back.
of course.
So team, thank you all so much for giving me that context. It really helps me to know who's in the virtual space. I'm so happy to be on this team with you. And I like the words that you shared because you're about to hear a lot of those same words over the next few minutes. So thank you so much for sharing and engaging with me. All right, so let's dive into this appetizer. Why trauma-informed care matters in behavioral health settings, and truly why it matters altogether. Team, when looking at why trauma-informed care matters in behavioral health settings, we first must keep in mind what trauma is. We have to define it. We have to put a name and face to what it's all about. Team, trauma is an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Now, when looking at age, gender, socioeconomic status, race, ethnicity, trauma has no boundaries. And according to SAMHSA, the Substance Abuse and Mental Health Services Administration, the effects of traumatic events place a heavy burden on everyone involved. Team studies show that 90% of behavioral health clients have experienced significant trauma. And trauma can present as symptoms of mental illness or substance use and can affect treatment engagement. It can affect how a client trusts the provider and also how well they recover. And when we look at the workplace reality, and today specifically behavioral health settings, behavioral health staff are more likely to encounter crisis situations. Clients with PTSD, complex trauma, or co-occurring disorders, as well as clients with high emotional intensity and unpredictability. Being a trauma-informed practitioner means recognizing that past trauma can shape a person's behavior. It shapes our emotions and our nervous system. And it's often invisible and has complex ways. It's an approach grounded in safety, compassion, dignity, rather than judgment, control, or assumption. Team, when we look at being trauma informed, we need to understand that it recognizes that past trauma truly shapes a person in all these many aspects. And we're going to keep that in mind today because, team, being trauma informed really does matter. Now, diving into SAMHSA's principles of being trauma informed, or the approaches that are taken, I want us to know and keep in mind that a trauma informed approach is a framework. It's a framework that recognizes and responds to the impact of trauma on individuals. And SAMHSA has defined trauma informed approach through 6 key principles that I want us to keep in mind. First, we have safety. When we talk about safety in this context, it's feeling physically and psychologically safe. Next, we have trustworthiness and transparency. And when we look at organizational decisions, it's conducting those with the goal of building and maintaining trust. Next, we have peer support. And in talking about peer support and mutual self-help, those are all very much key vehicles for establishing safety and hope. It involves building trust, enhancing collaboration, and utilizing lived experiences to promote recovery and healing. Next up, we have collaboration and mutuality. And in this piece, or this principle of being trauma-informed, or that trauma-informed approach, it looks at the importance that's placed on partnering and leveling power between staff or providers and the clients. Team, we also have empowerment, voice, and choice. And that's when organizations are able to foster belief, to heal and promote recovery from trauma. And finally, we have cultural, historical, and gender issues. And in looking at this, that's when we look at how culture and gender responsive services are in place. And they're offered while we move past having stereotypes and being biased. So all of these pieces, all of these principles are very important. So now let's apply this approach to behavioral health. First, looking at safety, let's look at that physical space. That's ensuring that the space is secure, and that our clients don't feel threatened by the posture of their therapists. It also provides for clients predictable routines, allowing them to know what's going to come next. In looking at safety, it also, in addition to physical, is emotional. There's no shaming language. We use a respectful tone, and we ensure that our environment is supportive. Next up, team, for trustworthiness and transparency, we want to make sure that our treatment plans are clear, that we provide informed consent, and that we are consistent with our follow-through. Next up, we have peer support. I really like this one. We use peer supports and lived experiences to help foster connection. And I can tell you here at the center, I always admire the way our coordinators and directors engage with each other. They come together and talk about what's going on. How can I help you? They learn from each other, and that's so very important. Next up, we have collaboration and mutuality, and that's where clients are seen as partners in the care. Again, we're doing this together, and they're not just passive recipients. We also have that empowerment, voice, and choice. That's when we offer treatment options and we respect refusal. We also co-create goals. We do it together. And then finally, team, with cultural, historical, and gender sensitivity, we want to acknowledge systemic trauma and historical mistrust. It's a real thing, and we cannot excuse it and say it didn't happen. We have to address the elephant in the room and move forward together. All right, so now that we've laid a little groundwork there for the appetizer, again, Brooklyn, I hope you're ready. Team, I want you to go back into the chat and looking at safety, trustworthiness, and transparency, peer support, collaboration, mutuality, empowerment, voice and choice, cultural, historical, and gender sensitivity. In the chat, which of these principles do you believe you currently do well? I only want you to pick one. Which one do you believe you currently do well right now in your behavioral health setting or whatever that workplace may be for you? And Brooklyn, let me know what you see in chat.
Yeah, sure. We have one for peer support. We have a safety. We have a trustworthiness, collaboration,
Okay,
peer support.
give me one more.
Okay. Collaboration and cultural sensitivity.
It sounds like we hit almost all of them except for one. So right now, team, I have one more question for you as we're engaging. Which one of these principles do you believe that you need to do the most work on to improve? That may be yourself or even the organization where you work. So right now, because there's always room to improve and grow, tell me which one of these six do you believe that you would like more information about because you want to get better with it? And Brooklyn's going to let me know what you should.
Yes. Someone said empowerment, voice and choice, empowerment. So four empowerments, one peer support, another empowerment, another peer support,
Hmm. Okay, give me one.
collaboration.
Okay. All right. Thank you for that, Brooklyn. And I know my Whole Health Louisiana teammates here from Monroe are on with me. So right now, team, Melissa and Annie, I want you to make note for me that empowerment, voice, and choice, peer support, and Brooklyn, I believe you mentioned collaboration. We're going to
Yes.
keep it in our back pocket as we're working in our curriculum, our training and technical assistance as we engage with communities over the next couple months. And we want to keep that in mind. So as you can see, I did a little work there on the background, getting some information for you. So thank you so much, team, for helping me out. And thank you, Brooklyn. I'll give you a little rest.
Of course.
All right, team. So we gotten our appetizer all done. I hope it was good. It was good to me. So let's move on. Let's move on. So the appetizer again has been served, and I want us to move to our entree, our ABCs and 1, 2, 3s of trauma-informed approaches. Now, team, as we move into the entree, I want to glean from my past experience working with Head Start and early Head Start programming, notably with prime time Head Start under the umbrella of the Louisiana Endowment for the Humanities. Now, throughout each school year, as we work with our preschool students, we would always align curriculum pieces back to letters and numbers. Those were the building blocks. Those letters and numbers served as our foundation, and they helped our children to easily remember things. Okay, so I want us to go back to preschool a little bit because a lot of those principles, those foundational pieces we learned when we were 3, 4, and 5 years old, they still ring true today. And just like within a school setting, therapeutic service teams also have many letters when it comes to evidence-based practices that they work with each day with their clients. So I like to call it that alphabet soup. But team, today we are not going to explore TFCBT, EMDR, or CPT and all the other alphabetic practices, but I want us to get back to the basics and first begin with our ABCs, which form the mindset of being trauma-informed. Team, before we adopt any type of approach with our staff, I would admonish you and truly, truly recommend to you that we get back to the basics and make sure that our team knows the ins and outs of these ABCs so that when they get ready to do TFCBT and all of those other evidence-based practices, they can do so, do it well because they have the basis in place. All right, so now let's jump into the mindset. So A is for awareness. When we are aware, team, we recognize signs of stress or dysregulation. When we are aware, we are mindful of our words and our tone, and we understand that behavior often has a backstory. Everybody has a story. Awareness means noticing without judging. When you are aware, you understand that trauma is common and it can affect anybody. You notice signs of stress or trauma in yourself, so the self-awareness is key, as well as with others. You also recognize how workplace practices and environments can either help or harm. Team awareness is the first step, and we can't respond to something we don't recognize. Trauma shows up in many ways: difficulty in concentrating, being easily triggered, or even physical symptoms like headaches. When we stay aware of how trauma might be affecting our coworkers and our clients and even ourselves, we can create safer, more supportive spaces. So I hope you make note that A is for awareness. Next up, team, we have B. B is for boundaries. And when we have boundaries, we set clear expectations. We also have respect for personal time and space, and consistency is there being built through trust. Boundaries protect everybody, both the client, the provider, the family, everyone involved. They give us structure and predictability. They give us safety. And with boundaries, we respect personal, professional limits for ourselves and others. It helps us to promote balance by encouraging breaks, reasonable workloads, and clear roles. Boundaries prevent burnout and protect both the staff and clients from harm. Team, boundaries protect everybody, and it's so very important for us to keep them in place. Clear expectations, healthy limits, respect for people's needs all help reduce stress and create trust. B is for boundaries. Next up, team C, make note, C is for compassion. When we have compassion, we lead with empathy, curiosity. We practice active listening and we offer support, not solutions. Compassion doesn't mean lowering standards, but it means supporting people to meet them where they are. With compassion, we lead with empathy and patience in every interaction. We build trust through kindness, consistency, and understanding. We recognize that compassion strengthens teamwork and resilience. Compassion is what brings it all together. Trauma often makes people feel isolated or unsafe. And when we show compassion, whether it's listening without judgment, checking in on a coworker, or giving someone grace on a tough day, we help restore the connection. Compassion is powerful because it helps people feel valued and supported. So team, we have A for awareness, B for boundaries, and C for compassion. So right now I have a short video that I want to play for you. And I want you to see if you can pick up on the ABCs. I also want you to dive a little bit into the nervous system and what's going on in the brain. And I believe this video does a really good job at putting all of those pieces together. All right, here we go.
For anyone supporting or working with individuals facing mental health challenges, embracing a trauma-informed approach isn't merely beneficial, it's essential. This paradigm fundamentally shifts how we perceive and interact with people whose difficulties often stem from profoundly traumatic past experiences. Mental health conditions present in numerous forms. While not every issue directly originates from trauma, significant distress can profoundly alter brain function, contributing to or intensifying conditions. When a person endures overwhelming stress or trauma, the brain's amygdala becomes highly sensitized. This results in heightened alert, making emotional regulation, concentration, and feeling secure difficult. The prefrontal cortex, governing rational thought, may become less effective, impairing coping. Memories might become disjointed, and individuals may struggle with trust or detachment. These are adaptive survival responses that, while necessary during trauma, become unhelpful daily. A trauma-informed perspective acknowledges these neurological and psychological consequences. It pivots from "what's wrong with you" to "what happened to you." It recognizes behaviors like withdrawal, anger, or treatment challenges are often understandable reactions to previous trauma, not defiance. By adopting this viewpoint, we cultivate psychological safety, build trust, and ensure clear communication. We empower individuals by offering authentic choice and agency over their care, fostering collaboration. This approach cultivates empathy and patience. When individuals with mental health challenges feel their experiences are validated and understood, they are more inclined to actively participate in support. This deepened feeling of trust and safety significantly enhances an individual's willingness to accept help. leading to improved engagement and more effective recovery. Global research consistently shows that a trauma-informed approach for mental health challenges leads to better outcomes for people. By fostering psychological safety and trust, individuals feel more validated and understood. This increased sense of safety significantly enhances their engagement with support, leading to improved participation in their own care, more effective recovery pathways, and ultimately, better long-term results. For more information,
All right, team. So I hope that video really gave you some insight, a little bit more into what's going on in the body. So much is happening there. And also, I'm hoping that it reminds you about the importance of making sure that on your plate, everyday therapist, as you're engaging with clients, your entree includes those ABCs of being aware, setting boundaries, and being compassionate, having that compassion. It's the mindset. So now let's look at the 1, 2, 3s. If the ABCs are the mindset, the 1, 2, 3s are going to be our action steps. There are some things that we have to do. So first up, we have number 1. 1 is for safe space. That psychological safety is key. It could be a quiet room or just a safe conversation, but identifying that space is so very important. And team, as we do that, the goal is for our therapists, our clients to feel that they can speak without fear. Also, it is important to remember that this is about more than physical space, but it's about emotional safety. One safe space means making the workplace feel steady and trustworthy. So team, this is even bigger than working with clients. It's working with each other, that steadiness and trustworthiness. That might look like clear policies, private areas for tough conversations, or simply a culture where people feel respected. Safety is the foundation, and without it, we can't focus, we can't learn, we can't heal, we can't work, we can't help others. 1 is for 1 safe space. All right, 2, big 2, two-way communication. When we have two-way communication, I've been trying to do a little bit about that with y'all this morning, or this afternoon rather. It encourages feedback. When you have two-way communication, you listen as much as you speak, and you avoid that mentality of having command and control. When communication is one way, people shut down. But when it's two-way, we engage. Two-way communication is about listening as much as you speak. Trauma-informed workplaces don't just hand down decisions, but they invite feedback. They ask questions, and they want you to ask questions, and there is open dialogue. When communication goes both ways, trust grows, and people feel valued rather than dismissed. So team, 2 is two-way communication. Next up, we have 3 consistent practices. And those are 1, regular check-ins. Next up, having predictable routines. And then we want to celebrate small wins. Here at the center, we try to meet with our staff in many regards once a week, every other week. We do things as a team as often as possible because checking in is so very important. Our team looks forward to that, and we want to make sure that we are consistent with that practice. Also, predictable routines, setting things up so that people know what's next. And then that's celebrating small wins. And truly in my thought process, every win is a big win. But even when you think something is small, celebrate it, because that's something small to you could be really big to somebody else. So those 3 consistent practices is key. Consistency is where trust is built. I know when I was at Primetime, we did a whole campaign when we were getting ready for an audit. And I tied in that C is for Cookie Monster from Sesame Street. But instead of doing cookies, as y'all see, I have this thing for food. C was for consistency because it's so very important. Team, trauma often comes from unpredictability. That's why consistency is powerful. When people know what to expect, whether it's how meetings are run, how feedback is given, or how support is offered, they can relax and focus on the work. It's okay to relax. Consistency builds stability, and stability builds trust. So 3 consistent practices. So we have 1 safe place or space, 2-way communication, and 3 consistent practices. So I have one more short video when thinking about the 1, 2, 3s, or action steps, that I want to share with you. And for this video, I want to draw from my school setting context again and share this video with that thought process in mind. And I believe that this video does a great job highlighting our 1, 2, 3s. So for the next few minutes, I want you to play a version of Find Waldo. But instead of finding Waldo, you are going to be looking for the 1, 2, 3s. 1 safe place, 2-way communication, and 3 consistent practices. Now, I want you to be looking for, do you see check-ins taking place? Do you see any signs of routines, schedules, agendas? That may be a little tricky, but you may have to look a little hard for it. And can you see or spot celebrations of small wins? And as you spot the 1, 2, 3s, I want you to feel free to put it in the chat. So as the video is playing, you can put it in the chat. But again, we are about to play Find 1, 2, 3s. Here we go.
If you're fearful, if you're anxious, if you're distracted about something that's happened to you or your family, you literally can't learn. Your brain shuts down. It's essential to give kids social and emotional tools to go with their intellectual tools.
When they walk through the door, they don't leave everything that has happened at the door. They bring it with them. Operating a trauma-informed approach is the understanding that we have to be able to help them manage their experiences in productive ways.
Having that lens makes it less about are they doing the right thing or the wrong thing, and more about where is that behavior coming from, why is that happening, what can we do about that.
Schools are powerful places. That's why it's so important as educators that we don't contribute to the trauma that many of our young people experience day in and day out. It is our responsibility to ensure that schools are places of healing, places where our students can thrive.
How was school today? Good. Class been okay?
Yep.
Okay.
We're gonna share a high and a low experience.
Last week, my anxiety started coming back really bad, so I've just been learning how to cope with that.
It feels frustrating for me and I have to take a breath, catch myself.
We just struggle a lot in my math class.
When a strong relationship exists with a teacher, with a mentor, with an advisor, it actually can reverse the effects of the adverse experiences. Children are amazingly resilient if they get that opportunity for attachment, for comfort, and for problem solving with a caring adult.
Good morning, Jolene. We're glad you're here.
All right, team. So I hope that you entered some of those aspects of the 1, 2, 3s in the chat. Brooklyn, did anybody enter something in the chat for me? Did anybody see 1 safe space or 2-way communication, or even some of those 3 consistent practices of regular check-ins, predictable routines, and celebrating small wins? What's in the chat?
Yes, so we had a few said safe place. We had someone say a child taken to a room with a counselor to talk quietly and privately. We had someone say predictable routines, staff greeting students at the door, safe place, safety, and check-ins.
Thank you so much. So again, team, I know that this video was within a school setting, but there are so many of these aspects that can be translated into the behavioral health setting wherever you work, because it starts from the front door to the back, from that initial assessment, intake. All of these pieces can be incorporated to make sure that we have those actionable items in place of our 1, 2, 3s, because those are our action steps. So thank you so much for participating in Find Your 1, 2, 3s. All right, team, we had our appetizer, we had our entree. Now it's time for what I love, the dessert. Yes, for all those sweet tooths, the dessert. And I want to give you some practical approaches, things that you can leave with and either start doing or continue to do as you are integrating trauma-informed approaches into your behavioral health settings. First up on the screen, you see a couple of things noted here. And first is client engagement. Team, remember to build your sessions with orientation. What to expect? Let your clients know that it's a confidential space. Set those goals. Avoid abrupt topic changes and give warnings before transitions. And always ask permission before asking sensitive questions. Next up, we have language use. Replace what's wrong with you with what happened to you. So being mindful of the words we use in addition to how we say them. Avoid clinical jargon when not needed, and come from a strength-based approach to our language. Next up, environment, our environmental design. Really work hard to ensure that your spaces are comfortable, private, and that there are areas where you can, the clients can really engage with sensory and calming aspects. So very, very important. In addition, clear signage to reduce disorientation and anxiety. Very important in setting up that space. I have to say, over the last couple of months, I've had a chance to visit our center sites in Shreveport and Crowley, Monroe, West Monroe, and even in Mississippi. We serve counties in Mississippi. And I've just been so impressed with how our spaces are set up. They're warm and inviting. It welcomes people to come in and begin that healing process. So very important. Next up, crisis de-escalation. Keeping your voice low and steady. Offering choices. Would you like to sit here or in a quiet room? And respecting personal space. So client engagement, language use, environment design, and crisis de-escalation. Next up, I also want you all to keep in mind the well-being of your staff and the vicarious trauma that they may be presented with. And in keeping that in mind, let's make sure that we have regular debriefing after difficult sessions. It may mean that some of our clinicians may need to have sessions with other clinicians. It's so very important to debrief. Again, boundaries that B is big. Avoid over-identification with clients' trauma. Self-care policies, again, built-in breaks, access to counseling, and workload monitoring. And then peer consultation. We want to normalize processing emotional impact. You are not in this by yourself. And it's important to embrace others through those peer support and collaborative practices with various communities to really talk things through, bounce ideas off of each other. So very important for staff well-being. And finally, team, I want us to look at organizational implementation. When it comes to training all staff, including admin from the CEO down, everyone needs training because, again, we're in this together and it takes all of us. Policies need to be aligned, whether that's with discipline, intake, safety protocols. It's important that they all reflect trauma-informed values. And team, I know many times people don't like to look at this third bullet, but measurement and evaluation, it's important. It's important to know what's the baseline, where are we, and where do we want to go so that we can continue to grow and make improvements. Client feedback, staff climate surveys, outcome tracking, that's all very important for us to keep in mind when it comes to measurement and evaluation. There may be some things shared that we don't like, but in order for us to grow, we need those pieces, measurement and evaluation. All right, my last engagement, because I know our time is running short. I'm having such a good time. This meal has been good to me. So team, right now in the chat, I want you to look at these items, keeping in mind that trauma-informed care is not a one-time training, but it's an organizational shift. Every interaction from the front desk to discharge matters. So as we get ready to wrap up, I want to leave you with a call to action. Oh yes, a call to action. There is work to do. So from this list, which practical approach do you think you can commit to in order to support a more trauma-informed culture in your work setting? So right now in the chat, I want you to choose one. I know the list is a little long, but just pick one. Put it in the chat, whether it's engaging more with clients, being more aware of your language usage, the environmental design, crisis de-escalation, having those regular debriefing times with your team, setting boundaries, self-care policies, peer consultation, training, policy alignment, or measurement and evaluation. What area do you believe that you want to make a big change to today as your call to action? Brooklyn, what do you see?
Yes, so I see 5 people saying training. That's the most popular one. We
Okay.
have language use, peer consultation, training, of course. Someone said that they are responsible for training the advocacy team at their
Okay.
organization. We have crisis deregulation, and
Okay,
we
give me
have peer
one more.
consultation.
Okay, awesome. And again, my Whole Health Louisiana team, Melissa and Andy, I hope you're making notes there. That's really good input for us. Brooklyn, thank you so
Of
much.
course.
Thank you so much. All right, team. Woo, this has been fun. So, like any good teacher, we always got to go back and recap. We had some objectives in the very beginning, and I want to make sure we hit all of those. So, team, today, trauma and its impact, we defined it and we looked at why it matters. We also looked at SAMHSA's 6 principles of trauma-informed approach. I hope that you keep those in mind: safety, trustworthiness, and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender sensitivity. We also went to our entree, the foundational pieces, those ABCs and 1, 2, 3s. A for awareness, B for boundaries, and C for having compassion. And then those 1, 2, 3s, 1, safe space, 2-way communication, and 3 consistent practices. Those regular check-ins, predictable routines, and celebrating every win, whether big or small. Celebrate it. It's so very important to do so. Team, I have had a blast with you. And before I leave, I do want to again give a big shout out to all my teammates in Louisiana and Mississippi who do this important work for me each day at the Center for Children and Families. I want to leave with you all a URL. So if you want more information about who we are, what we do, please look us up. I'm also including our phone number and fax. If you would like for someone to come and do training, give us a call. If you want more information about counseling, advocacy, prevention work, any of those pieces, give us a call. We're here for you. We're in this together, teammates. So, I don't know about you, but I have enjoyed the appetizer, the entree, and the dessert. Dessert for the ABCs and 1, 2, 3s. Quinn and Brooklyn, thank you. This has been a blast. Again, team, my name is Stalanda Butcher. I'm here. Give me a call. Stop by and see me. See me an email. This work is so very important. For all my organizations in Northeast Louisiana, if you are interested in Whole Health Louisiana training, technical assistance so that your workplace can become more trauma-informed, let us know. We'll be starting community meetings really soon to dive into this important work because there's so much work to do. Again, thank you so much for your time. Again, consistency. This is not a one-time thing. We have to make some cultural and organizational shifts, but we can do it together. Thank you so much. Quinn, I'm going to give it back to you.
Thank you so much for your amazing presentation. I've learned so much. Before I hop into questions, I'm going to say a couple of announcements real quick. everyone who's getting CEUs, please remember to fill out the survey, and that you have 2 business days to fill it out if you want your credits. And check out all of the other announcements that are in the chat that are relevant to CEU credits if you are getting those. Okay, so we have one question for you in the Q&A, and Edward asked, if trauma comes from an institutional source, how can members of that institution work to help those affected without causing further harm to someone?
Wow, that's a big question, and thank you so much for that question. So, and again, did you say his name was Stuart? I want to make sure I address him, or Edward. Trying to remember the name. You know
Edward.
it. Edward. Okay, well, Edward, thank you so much for the question. First of all, we have to acknowledge where we have issues. We can't move forward until we acknowledge that as a team. So if that trauma is from an institutional standpoint, I believe that it is very important for leaders to come together and address it. We have to address the elephant in the room, put it out on the table, be accountable. If we're a part of that, we have to own our accountability for it, bring in multiple voices and work together. We can't get stuck in it. We have to address it, but we have to move forward and acknowledge it. So accountability is key. And I believe that it starts with leadership. So in a nutshell, in order to move past institutional trauma, we have to start with the head. They have to be accountable, trickle down. And I believe that's when we see movement. It's not easy, but it can be done.
Thank you for that answer. Does anyone else have any other questions for our speaker? Feel free to drop it in the Q&A box, or you can drop it in the chat. The chat is still open, I believe, as well. We have another question, and this one asks, has there been any pushback to trauma-informed care with the current changes to the educational system in Louisiana? It's a great question.
That is a great question. And I just want to be very transparent here. I haven't dived too much into it right now with looking at, because there have been so many changes, but I will say in our work with Whole Health Louisiana, education is going to be one of the sectors, the key sectors that we want to work with. We are planning to get with superintendents, school leaders, teachers, even students. We want to hear, with all of these changes, what does that mean for you? So again, I would say so, but I think that that's something we as a team here at the center, we plan to dive into to see what we can do to help make sure that things are in place so that school settings are more trauma informed. I also want to lean on some of our partners in the Shreveport part of the state. I know that they're doing a lot of good work with trauma informed approaches in schools. So I believe, we never have to recreate the wheel. Let's see what's out there, work together. Yeah, over the next couple months, I look forward to diving into that to see how we can help educational systems become more trauma informed. Every entity can glean something from this model, from these approaches. Thank you for your question.
And a follow-up question to that said, what partners/clients are the most receptive to trauma-informed care?
Ooh, okay. Well, Edward, Edward, I need to meet you in person. You have some good questions. I don't think that we can lump anybody into one bucket. I really think it depends on who that therapist is. If you have a therapist who's embracing those ABCs and 1, 2, 3s, I think they can work with anybody. I know here at the center, I've heard stories of how we've had clients who've been so resistant, who have faced a lot of trauma, where they have worked with other entities and haven't been able to basically crack that nut. But we have clinicians who are patient. They are aware of what's going on. They set those boundaries. They're showing compassion. And then they have those action items, and that's when they begin to see the needle move. So again, Edward, thank you for the question, but I don't know if we can lump that into one bucket. But I do believe that we can say if we have therapists who are keeping all of these pieces in mind, that's when we can begin to see really big improvement in healing from our clients.
Thank you for your answer. I have one question myself, actually. So, we talked a lot about how people can integrate trauma-informed practices into their work. So, I'm curious how at this the Center for Children and Families, what does that look like internally for you guys? Maybe like it could be helpful for people who are trying to integrate that into their own workplaces to see something
Sure.
that people can model after.
Yeah, that's great. So first, I invite anybody on this webinar to come visit us. Our administrative offices are here in Monroe, but again, we have medication management and counseling in West Monroe. We have sites in Shreveport, Crowley, and as I noted, we have a site in Clinton, Mississippi, where we provide services to 7 counties. So Quinn, let me tell you, from the moment you step into our building, we have a beautiful receptionist by the name of Paula. She even has things pinned up just to remind her. You know, sometimes many people look down upon those things, but just easy reminders. So when someone calls, these are things that you need to remember to say. Remembering to greet people with a smile. Also make sure that you know the ins and outs of the work that you do. So if you're asked a question, you don't always put them off to somebody else, but you can articulate an answer or know how to direct them to get the material they need. So it starts from the front door. Also, Quinn, let me tell you, we set a tone here where we really do value, but let me tell you, work is of utmost importance, but we make sure that we provide time for our staff to engage with each other. We have times where in the break room, they're talking. We have a huddle series just this morning, an executive session. We're mapping out our next 6-week huddle series, so we'll be able to bring the team together and dive into an important aspect so they can all be in one room, learn from each other, and keep this movement going, keep the work going. So it's important to have a focus upon the client, the community you serve. But Quinn, I do believe that for organizations to truly be trauma informed, they also have to keep the staff. Those who are doing the work, they have to stay in focus, making sure that we have times for staff to step aside and breathe. When it's a staff's birthday, oh my goodness, Quinn, you need to come and hear when we do the birthday song. It's just beautiful, music to your ears. And all these things may seem small, but to people, they're big because you never know what someone is going through. So Quinn, to answer your question, and I can send you a full list of different things that we do, but in essence, I believe that the beauty here at the center is that we keep everybody in focus, our clients, community, but we don't forget about our staff. Those actually doing the work, we take care of our team, and it's so very important.
Thank you so much for your answer. I think we have time for these last 2 questions real quick. One in the chat asked, what's 1 or 2 common mistakes you see well-meaning professionals make when trying to apply trauma-informed care, and how can we avoid them?
Okay. Well, just one thing that I've seen, notably with my time in school-based health, I had an opportunity for 10 years to work in a school-based health setting where we had nurse practitioners, RNs, we also had counselors, social workers, and it's just a beautiful model. But one mistake that I know, even as a young leader, I made was adopting all of these different practices. Okay, we need to do this, we need to do that. But I didn't ensure that the team had the basis by which to do that. I wasn't always doing those check-ins. If we want to do a practice with fidelity, there are just pieces, foundational pieces that have to be in place first. And that's why I think this presentation is so very important, getting back to the basics. Yeah, EMDR, it's beautiful, and all of those other EBPs or evidence-based practices, but there are some foundational pieces that we have to have in place for staff first before we can do any practice with fidelity. So that's what I believe we need to do. Get back to the basics, make sure that staff are good, make sure that staff wellness is in place, and then we can bring in the different practices for our clients. So have that focus upon our staff, very key.
Okay, and last question, real quick before our time ends. Many students are angry. Do you think an elective anger management would help students cope at all levels, pre-K to 12?
Yeah, I can tell you, I'm going to dive more into some recent legislation that I know one of our local representatives, Adrian Fisher, helped to author, but it's making sure that we have those mental health pieces in place in schools. But yes, to answer your question, I don't know if it's so much an elective or just having a quiet room, just different things for children to be able to get away and do, to talk to somebody. It's so very important. I think about what children are going through right now. It's totally different from what I went through when I graduated from DeRidder High School almost 30 years ago. And we have to keep that in mind. We need to stay abreast with the culture. What are children into? What are they doing? And making sure that we have things in place to make sure that mentally they are good to go. Because a child who is angry, they're not going to learn, they're not going to be receptive. We have to get to the root cause and set them up for success.
Thank you so much for that answer. And that marks our time, just right on time. Thank you so much, Stalanda Butcher. And thank you to our interpreter, Lisa Gill, for interpreting today's webinar. Thank you everyone for attending. Our next Lunch and Learn will be on September 18th with Dr. Catherine Keating. So please look forward to that. And as always, please take the post survey. That will be greatly helpful to us. Thank you everybody so much.
Thank you. Bye-bye.